Welcome to our deep dive today. We've got a fascinating study to unpack. It's all about spinal only meningoencephalomyelitis of unknown origin, or MUO for short, in French bulldogs.
Yeah, it's a mouthful, isn't it? MUO.
It is.
It's a pretty interesting area of study. So as you mentioned, MUO is an inflammatory disease. It affects the spinal cord and sometimes even the meninges, which are those protective membranes surrounding the brain and the spinal cord. And the thing is, it's what we call a diagnosis of exclusion. So we only arrive at that diagnosis by ruling out other things like, say, infections or tumors. So this particular study that we're looking at by Boudou and their colleagues really focuses on MUO in French bulldogs. And this was published in the Journal of Small Animal Practice just last year.
Yeah. And I noticed they had 15 French bulldogs in the study, which seemed kind of small to me. But I imagine finding MUO cases, especially in a specific breed like Frenchies, is probably pretty tough.
Yeah, you're absolutely right. I mean, MUO is already considered uncommon. And then on top of that, you're looking at a specific breed. So finding a decent number of French bulldogs with MUO suggests that there might be a breed predisposition here. And actually, a previous study did find that MUO makes up a good chunk of what we call encephalopathies, so brain diseases in French bulldogs. So yeah, it's a really valuable study focusing on Frenchies like this.
Okay, so we're dealing with a rare condition in a breed that seems to be more susceptible to it. What can you tell me about the dogs in this study? Like, what were they like?
Well, the first thing that jumped out at me was their age. The median age at diagnosis was only 31 months.
Wow, that's young.
Yeah.
I would have thought a condition like this would show up in older dogs.
Yeah, you would think that, right? I mean, many neurological issues do tend to affect older dogs. But seeing this in French bulldogs that are really only like 2.5 years old, it raises some questions. Could there be a genetic component here? Are there some environmental factors we're not thinking about? So it's definitely something that needs more digging for sure.
So we've got these relatively young Frenchies. How did this condition actually show up in these dogs? Like, what were the owners seeing at home?
The study found that most of the dogs had what we call a chronic onset of symptoms, meaning the problems kind of developed over time. And the median duration of symptoms before the dogs were actually diagnosed was 21 days.
Oh, wow.
Which is interesting because it might explain why sometimes MUO in French bulldogs gets misdiagnosed as IVDH, so intervertebral disc herniation, which is much more common, especially in Frenchies.
Oh, it's okay, because it comes on slowly. And it could look like other things. It might take a while to get the right diagnosis.
Exactly.
So what were the most common things the researchers were seeing in these dogs?
The most frequent signs were something called ambulatory paresis, which basically means weakness in the limbs, making it difficult to walk, and then also what we call proprioceptive ataxia, which is a lack of coordination. So the dogs kind of don't know where their limbs are in space. So basically these dogs are wobbly and having trouble walking normally.
So I can definitely see how that could be confused with IVDH. Were there any big differences that kind of helped the researchers know it was MUO and not IVDH?
Yeah, there was one striking difference, and that was pain. So spinal pain is a very common sign in French bulldogs that have IVDH.
Right.
But in this study, spinal pain was seen less often in the dogs with spinal-only MUO.
Interesting.
Yeah, so this is a really important difference that vets can use to help them figure out what's going on.
So if a Frenchie comes in with those walking issues we talked about,
Yeah.
but there's not a lot of back pain like you'd expect with IVDH, that could be a sign that maybe it's at MUO.
Yeah.
So that's super helpful for vets to know. How did they actually confirm that it was MUO in these dogs? What tests did they do?
MRI was really important, and it actually showed abnormalities in the spinal cord in most of the dogs. And typically, these lesions, so these areas of inflammation, showed up bright on something called T2 weighted images and kind of blended in on T1 weighted images, so different types of MRI scans. And a lot of these lesions also showed contrast enhancement. So they lit up even more brightly after a special dye was injected. And that helps to really highlight the inflammation.
So they could actually see the inflammation in the spinal cord on these images, pointing towards MUO. Were there any other tests that they did to confirm?
Yes, they did something called a cerebrospinal fluid analysis, so CSF analysis.
Right.
And they found higher cell counts in the CSF, mostly what we call mononuclear cells. So these are specific types of immune cells. And that further supports the idea that there's inflammation going on, and it helps to rule out some other conditions too.
Okay, so it's all starting to make sense. They ruled out other things. They saw inflammation on the MRI and in the CSF. That seems like pretty solid evidence for MUO, but I know MUO is a diagnosis of exclusion. So how did they definitively rule out other potential causes?
They were very thorough. They did a bunch of tests to rule out other possibilities, including testing for infectious diseases that can sometimes look like MUO.
Got it. So they ruled out infections. They saw that inflammation. It's looking more and more like MUO is the problem here. So then what happens next? How do you even treat a condition that basically has unknown in its name?
Well, that's the million-dollar question, isn't it? And it really shows how complicated this condition is. Even though the exact cause is unknown, we do have ways to try and manage the inflammation and hopefully make the dog feel better. In this study, all of the dogs were treated with what we call immunosuppressive doses of corticosteroids.
So medications that basically suppress the immune system.
Right.
Which makes sense if we're thinking it's the body's own immune system that's causing the inflammation.
Exactly. The idea is to kind of calm down the immune response and reduce that inflammation in the spinal cord. Some of the dogs in the study also received additional immunosuppressive treatments, like cytosine arabinoside or cyclosporine, to further help control that inflammation.
So kind of layered approach, starting with the corticosteroids, and then maybe adding in other medications if needed. What about the outcomes? Did the dogs respond well to this treatment strategy?
The good news is that most of the dogs did show improvement. Some of them even had complete resolution of their neurological signs, meaning they went back to normal. And this happened within a few weeks for some of them.
That's amazing. That's got to give hope to owners who are dealing with this diagnosis. But I'm guessing it wasn't that straightforward for all of them?
You're right. Not all of them had such smooth sailing. About a quarter of the dogs had what we call relapses. So even with treatment, it can be unpredictable, with ups and downs along the way.
So it sounds like it's something that needs to be managed and monitored over time, even if the dog seems to have fully recovered. Did the study give any clues about why some dogs relapsed and others didn't?
Unfortunately, the study didn't find any specific predictors for relapses. And that's one of the frustrating things about MUO, is that it's so unpredictable. More research is definitely needed to understand what might be influencing the long-term course of this disease.
Yeah, it would be great to know what makes some dogs do better than others.
Yeah.
Now, earlier you mentioned comparing spinal-only MUO to IVDH in French bulldogs.
Right.
Besides the difference in pain that we talked about, were there any other key differences between the two?
Interestingly, the researchers found that what we call the neurologic grade, which basically measures how severe the neurological deficits are.
Okay.
It didn't really differ between the dogs with MUO and those with IVDH. They also found that the location of the lesion, so where the problem is in the spinal cord, was pretty similar between both groups.
So while those factors can be helpful in pinpointing where the issue is in the spinal cord, it doesn't really help differentiate between the two conditions. So a really thorough exam and all those tests are super important to make the right call.
Absolutely. It's like being a detective. You got to put all the clues together, the clinical signs, what you see on the MRI, the CSF results, and then you can kind of piece it all together and hopefully make the right diagnosis.
Speaking of clues, the study specifically looked at French bulldogs. Do you think what they found has any implications for other breeds that might be prone to getting MUO?
While this research was just on Frenchies, what it tells us about how MUO looks, how we diagnose it, and how we treat it, can definitely be applied to other breeds that might be dealing with similar neurological problems. It's like a roadmap that can be adapted for other dogs.
So it's bigger than just French bulldogs. It's about expanding our understanding of MUO in general and using that knowledge to help any dog that might be affected by it. The study mentions that French bulldogs seem to be predisposed to MUO.
Right.
But do we actually know why? Are there specific genes involved, or is it more just like a general breed susceptibility?
That is the question everyone wants answered.
Right.
And as of right now, there aren't any genes that we know for sure are linked to MUO in French bulldogs or any other breed for that matter.
So we're still kind of in the dark about the genetics of MUO.
Yeah. And figuring out the genetics is super important because if we knew what genes were involved, then maybe we could develop genetic tests that could help breeders make good decisions and potentially reduce how often we see this condition in French bulldogs.
That would be incredible, not just for Frenchies, but for any breed that can potentially be affected by MUO. So what about treatment? Are there any promising new therapies on the horizon that might offer more targeted or maybe even more effective treatment options for dogs with MUO?
Well, that's the million-dollar question, right?
Right.
Right now, those immunosuppressive medications are really the main treatment for MUO, but researchers are always looking for better treatments, more specific and more effective therapies.
So it's all about improving the lives of these dogs and giving them the best possible chance at a long and happy life.
Yeah.
What are some of the promising areas that researchers are looking into?
One area that has potential is something called monoclonal antibodies.
Okay.
So these are basically laboratory-made proteins that can target and neutralize specific parts of the immune system.
Wow.
Pretty cool stuff. And another area is stem cell therapy. So using stem cells to try to actually repair the damaged spinal cord tissue.
Oh, wow.
So lots of exciting research going on.
Yeah, there's so much potential there. It's exciting to think about what the future holds for treating MUO. But while research is going on, what about supportive care? What does that mean? And what can owners do to make sure their dog with MUO is getting the best possible supportive care?
Supportive care is all about doing things that help the dog's quality of life. This includes physical therapy to keep the muscles strong and flexible, pain management to keep them comfortable, and even just making changes around the house so it's easier for them to get around.
So like ramps or things like that.
Exactly. It's all about adapting to their needs and giving them the love and support they need to thrive, even with MUO.
So it's making their lives as comfortable and enjoyable as possible, despite the challenges.
Exactly. And that's something owners can do day in and day out. That consistent love and care can make a huge difference.
It's a good reminder that even with a tough diagnosis, there's always hope. And that with the right care and support and lots of love, dogs with MUO can still have happy, fulfilling lives. The study we've been talking about focuses on the science of MUO, but it also mentions how this condition affects both the dogs and their owners emotionally.
Right.
It's not just about the physical symptoms, it's about the whole experience of dealing with a chronic and unpredictable neurological condition.
Yeah, exactly. Imagine the worry and the uncertainty that owners go through when their dog is struggling with MUO.
It must be so hard.
Yeah.
So what can vets do to help those owners who are dealing with this?
Vets play a really important role, not just in providing medical care, but also in giving emotional support and guidance. It's about clear communication, empathy, and just taking the time to really listen to what the owners are going through. It's about being a partner in the dog's care.
So it's recognizing that it's not just the dog that needs care,
Right.
It's the whole family.
Precisely, and that's what compassionate veterinary care is all about.
Now, this research was about MUO in French bulldogs, but I think it has implications for the health of dogs in general.
Yeah, I think so too.
It reminds us that some breeds might be more prone to certain health issues, and that we all need to be aware of that. Breeders, owners, and vets. What can we do with this knowledge to help keep dogs healthy?
For breeders, it's really important to prioritize health testing and to be upfront about any neurological conditions that have been seen in their breeding lines. So transparency is really key.
So that potential owners can be aware and make informed choices.
Right. It's about everyone working together, breeders, vets, and owners, to make sure these dogs are as healthy as possible.
So it's a team effort to make sure that French bulldogs, and all dogs really, can thrive. What about early detection? How can owners spot those early signs of MUO so they can get their dog to the vet as soon as possible?
Education is so important here.
Right.
We need to teach owners what to watch out for, like subtle changes in the way the dog walks if they stumble now and then, any kind of decrease in coordination.
It's about being aware of those little signs that something might not be quite right.
Exactly, and it's not just about what you see. Pay attention to any changes in their behavior, too. Is your Frenchie suddenly more withdrawn? Are they less playful than usual? Those could be signs as well.
So if you noticed anything different with your Frenchie, it's always better to be safe than sorry and check in with your vet.
Definitely. Early detection is so important because the sooner you catch it, the sooner treatment can start.
Right.
And the better the chances are of minimizing long-term problems.
So it's about giving owners the tools to advocate for their dog's health.
Right.
And that proactive approach doesn't end with just detection. It extends to the long-term management of MUO.
Yeah, that's really important. MUO is often a long-term commitment. It's about working with your vet to adjust the treatment plan as needed and just giving your dog all the support they need.
So it's a journey, not a quick fix.
It is. And you might have to make changes at home to accommodate your dog's needs. Think about things like ramps to help them with stairs or a harness to support them on walks. Making sure they're comfortable and safe at home is key.
It's about making those adjustments and giving them the love and support they need to live their best life, even with MUO.
Exactly. Those little everyday things you do for them make a big difference.
It's really amazing to see the bond between people and their dogs, that dedication to their well-being.
It is. And that dedication, that shared commitment to their care is what fuels our efforts to tackle MUO and any other challenges that our furry friends might face.
I'm curious about those dogs in the study who didn't have the full range of tests for infectious diseases.
Hmm.
Why was that? Wouldn't that be really important to rule out other possible causes?
Yeah, you make a good point. And the researchers did mention this as a limitation in their study.
Okay.
They explained that in some cases, they couldn't do all the tests, either because of financial reasons or because the tests just weren't available.
So even though they were thorough, there's a slight chance that some of the cases might not have been MUO after all.
It just shows how complex veterinary medicine can be. We don't always have all the answers. And sometimes we have to make decisions based on the information we have at the time.
It's a good reminder that medicine, whether for humans or for animals, isn't perfect. There's always some uncertainty.
Absolutely. That's why it's so important to stay open to different possibilities and to be willing to adjust our thinking as we get more information.
So it's all about continuously learning and adapting to provide the best possible care.
I couldn't agree more. You know, we've talked a lot about the science of MUO in French bulldogs,
We have.
but I think there's another really important piece to consider, and that's the personal stories.
You're so right. Hearing those stories from both the dogs and their families really brings this research to life.
Right.
And reminds us that behind all the science and the data, there are real dogs and real people who are dealing with this condition.
Exactly. And there was one story in the study that really stuck with me about a young Frenchie named Coco.
Oh, I love that name.
Yeah, Coco's a great name. Her story starts subtly, with just a little limp and maybe tripping a bit every now and then.
Those early signs can be so hard to pick up on, especially in a breed that's known for being a bit clumsy.
Exactly. But Coco's owner, Sarah, she noticed that something just wasn't right. And so she decided to take Coco to the vet.
I bet that quick action was super important for Coco.
It was. After an exam and an MRI, Coco was diagnosed with spinal-only MUO.
So there it was, hiding beneath those subtle signs.
Sarah was heartbroken, of course.
Of course. She had only had Coco for a year,
Right.
and this diagnosis just felt like it was stealing their time together.
Yeah. And I think a lot of owners can relate to that fear.
Definitely.
But even though she was scared, Sarah was determined to fight for Coco. She worked with her vet, she gave Coco all her meds, and she gave her tons of love and support.
It just shows you the incredible bond between people and their dogs.
And thankfully, Coco started to get better. Within a few weeks, she was back to her old self.
Oh, that's great to hear.
Yeah, it really is. It gives you hope, right?
Definitely.
But I'm guessing Coco's story didn't end there.
You're right. A few months later, Coco had a relapse.
Oh, no, that must have been so hard for Sarah.
It was. But she never gave up on Coco. They adjusted the treatment plan, and Coco got better again.
Oh, wow. What a fighter.
Coco's story really shows us that MUO can be a roller coaster, with good times and bad times along the way.
But through it all, it's a testament to how resilient these dogs are and how much their owners love them.
Absolutely. It's about hope and never giving up, and the incredible bond we have with our dogs. As we think about Coco's experience, it makes me wonder, how can we use these stories to help other dogs who have MUO?
That's a great question. How do we take these personal experiences and turn them into something bigger that makes a real difference?
It's about moving from awareness to action,
Right.
taking those individual stories and using them to create a positive impact.
And maybe that's a perfect place to pick up in the next part of our deep dive. Welcome back to our deep dive into MUO in French bulldogs.
It's been quite a journey so far, hasn't it? It really has. We've talked about the signs, the challenges of diagnosing it, the treatments, and even how it can affect everyone emotionally.
And now we're at a really important point. We've learned so much about MUO, but what do we do with all this knowledge? How do we use it to make things better for these dogs?
That's the big question, isn't it? We've gathered all this info. But where do we go from here?
Well, I think the first step is admitting that we still have a lot to learn. Even though we've made progress in recognizing and treating MUO, there's still so much we don't know.
So the puzzle isn't complete yet.
Exactly. And that's where more research comes in. We need more studies to really dig deeper into the causes, the risk factors, the long-term effects of MUO in French bulldogs. Imagine if we could find specific genes or environmental factors that are involved.
That would be a huge breakthrough. It could lead to earlier diagnosis, more targeted treatments, maybe even ways to prevent it.
It's about shedding more light on this mysterious condition and finding better ways to help these dogs.
And research shouldn't just focus on the science and medicine. It should also look at how MUO affects owners emotionally and financially.
Absolutely. We need to see the whole picture, not just the disease itself.
Okay, so besides research, what else can we do? We talked about responsible breeding practices earlier. With French bulldogs being prone to MUO, How can breeders help reduce the risk?
Even though we don't have specific genetic tests for MUO yet, breeders can still make health testing a priority.
So things like checking for hip problems or eye issues, which French bulldogs are known for.
Yes, and it's just as important for breeders to be open about their breeding practices and any history of neurological conditions in their lines. Being transparent is key.
That way, potential owners can make informed decisions.
Exactly. Everyone has a role to play: breeders, veterinarians, and owners. We need to work together to protect these dogs.
It's a team effort to ensure that French bulldogs and all dogs can thrive. What about catching MUO early? What can owners do to spot those subtle signs and get their dog to the vet quickly?
Education is key. Owners need to know what to look for. Subtle changes in the way their Frenchie walks, occasional stumbles, any loss of coordination.
So being really attuned to those little hints that something might be off.
Exactly. And don't just focus on physical signs. Notice any changes in their behavior, too. Is your Frenchie suddenly more withdrawn or less playful? Those could be signs as well.
So it's always best to err on the side of caution and talk to your vet if you notice anything different with your Frenchie.
Absolutely. The earlier MUO is diagnosed, the sooner treatment can start, and that gives the dog a better chance.
It's about empowering owners to be proactive about their dog's health.
Right. And that proactive approach doesn't stop at detection. It also means being committed to managing MUO over the long term.
So it's not a quick fix, it's a journey.
It is, and part of that journey might involve making changes at home to help your dog. Think about things like ramps for stairs or a harness for walks. It's important to make sure their environment is safe and comfortable.
It's about making those adjustments and giving them the love and support they need to live their best life, even with MUO.
Exactly. Those small, everyday things you do can make a huge difference.
It really shows the incredible bond between people and their dogs, that unwavering dedication.
It does, and that dedication, that shared commitment to their well-being, is what drives us to find solutions for MUO and any other challenges our furry friends might face.
This has been an incredible deep dive, packed with insights and practical advice.
It has, and I think the key takeaway is that knowledge is power. The more we understand about MUO, the better we can care for these dogs.
So, to all our listeners out there, stay curious, keep learning, and don't be afraid to ask your veterinarian questions. They're your partners in this.
And remember, you're not alone in this. There's a whole community of support. Other owners, vets, researchers, all dedicated to helping dogs with MUO live their best lives.
And trust your gut. If something seems off with your Frenchie, get them to the vet. Early intervention can make all the difference.
It really can. And finally, never give up hope. Even with a diagnosis like MUO, with the right care, support, and lots of love, these dogs can still have happy, fulfilling lives.
That's a wonderful note to end on.
From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.